Good morning, Johns Hopkins Global Health Leaders Conference. My name is Adwaith Hariharan, and I'll be presenting the intersection of two pandemics, COVID-19 and tuberculosis. For those of you watching the recording, today is Saturday, July 16th, 2022. So a little bit about me. I'm a rising senior at Biotechnology High School in New Jersey. My interests lie at the intersection of STEM and humanities, particularly in the context of achieving social equity. I'm an avid researcher, and I've worked on AI-based healthcare projects, and I'm a genomics researcher with 2 published gene sequences in the NCBI GenBank. I'm also involved in multiple organizations and projects, some of which include the New York Academy of Sciences and the National Security Language Initiative for Youth. I work with multiple community-based organizations to make the STEM education accessible in the underrepresented, neurodivergent, Black, and Latinx communities through the creation of hackathons, science fairs, and science camps. With my interdisciplinary research interests in neuroscience, global health, and artificial intelligence, I aspire to pursue a career in medicine, where I hope to use technology and healthcare policy advocacy to tackle systemic barriers in disadvantaged communities globally. So today I'll be covering the following in my presentation. I'll start with a brief introduction, then move on to COVID and TB synergies and commonalities, followed by the devastating effects COVID has had on TB and TB and COVID-19 co-infection. And I'll round that off with the impact of COVID on the management and intervention of TB. And in conclusion, take a look ahead on the interventional strategies for the future. So diving into the introduction. So it may come as a surprise to many, but COVID is not the only pandemic currently ravaging the world. Tuberculosis, commonly known as TB, is a silent pandemic that accounts for 1 death every 21 minutes worldwide. COVID and TB are both infectious diseases. They are highly resilient, lethal, and airborne, and are the leading cause of death worldwide. COVID is obviously a crisis of the moment, and we don't know what its future will look like, but TB has been a global crisis for quite some time. The current pandemic has had devastating repercussions on all aspects of world health, but TB services worldwide have suffered disproportionately. The pandemic has reversed the progress accomplished toward combating TB over the last few years. According to the World WHO, there has been a considerable decline in tuberculosis testing and case notifications around the world due to quarantine restrictions worldwide, which has resulted in an increase in mortality and pushed global tuberculosis control back by about 10 years. So what is TB? TB, caused by Mycobacterium tuberculosis, is in fact treatable and curable, or at the very least, it can be kept in check. TB has been recorded in every single country worldwide. It's one of the leading causes of death across the globe, resulting in around 1.8 million deaths annually. The economic impact of TB for a 15-year period between 2015 and 2030 was estimated to be $958 billion. Similar to COVID-19, contagious TB-causing bacteria usually spread through tiny droplets from an infected person's cough or sneeze in the air. Once TB bacilli are inhaled and a person becomes infected, one of 2 things can happen. Either the person's immune system is too weak to stop the bacteria, and the bacteria multiply, causing TB. Such individuals are symptomatic and can spread the disease to others. Or the person's immune system fights the bacteria, and the bacteria become dormant or inactive and non-contagious. If left untreated, latent infection can turn active in the future. 5 to 10% of latent TB carriers will become sick in their lifetimes, and this is especially possible when the carrier's immune system is already compromised due to other illnesses like COVID and HIV. So COVID-19 and TB, synergies and commonalities. The initial clinical manifestation and spread of COVID and tuberculosis are very similar, the most significant being their transmission through secretions from the respiratory tract, with symptoms such as cough, fever, shortness of breath, fatigue, and loss of appetite. COVID-19 and TB pose a deadly dual threat, a syndemic that feeds on social inequities and poverty. A syndemic or synergistic epidemic is the aggregation of 2 or more concurrent or sequential epidemics or disease clusters in a population with biological interactions, which exacerbate the prognosis and burden of disease. So COVID-19 and the devastating effects on TB. TB case management and detection have drastically fallen due to COVID lockdowns, leading to an increase in TB numbers. TB modeling analysis indicates that the COVID pandemic is deeply affecting the efforts of TB services in prevention, case detection, and management. Modeling studies indicate that the number of TB cases between 2020 and 2025 is expected to jump 6.3 million, causing an additional 1.4 million deaths between 2020 and 2025. And this implies a setback of at least 5 to 8 years in the fight against TB. So now we'll move on into what happens when COVID and TB are co-infections. So how does this present clinically, and how is such a condition diagnosed? Analysis of co-infected patients with COVID and TB has shown that COVID can appear either before, simultaneously, or after TB, and this includes patients with post-TB treatment. The most common clinical manifestations of COVID-TB co-infection are fever, cough, dyspnea, weight loss, and fatigue. The main treatments for this co-infection include antiviral therapy, immune-based therapy, and adjunctive therapy. The CDC recommends the testing for both diseases separately, or at least have a low index for also testing for TB when testing for COVID-19. Some of the implications of COVID and TB co-infection include the misdiagnosis of TB due to similarities between COVID and TB, the aggravation of existing active TB, escalated risk and severity of COVID, and potential drug-drug interactions between COVID and TB medications. Mortality is higher amongst elderly TB patients with pre-existing comorbidities. COVID-TB co-infected patients were 2.21 and 2.27 times more likely to die or develop severe COVID-19 respectively. So the impact of COVID on the management and intervention of TB. Armed with COVID knowledge, advocacy, recommendations, and opportunities, we can target the lessons learned from COVID and apply them to eradicating TB. COVID demonstrated the role of communities in responding to crisis, reporting healthcare access barriers, supporting peers, and filling gaps in services. This pandemic is therefore an opportunity for global TB responses to be more people-centric and to involve communities by building back better. Acting in true syndemic fashion, COVID is driving people with TB further into poverty, social isolation, and increasing inequities. There is an urgent need to promote equity and access to financial support, transportation, healthcare, and food for all people with TB by providing social protection. Health systems around the world are weak and ill-equipped to respond to simultaneous COVID and TB epidemics. Governments must invest in health systems, and we must get better at using resources wisely by delivering care in an integrated way. People working in the TB field are seeing significant interruptions and diversions of their work and research into COVID-19. The COVIDization of overall research sectors, of overall health sectors, including communication, politics, implementation, and research, has diverted attention away from TB activities. Capacity needs to be built up. TB funding has decreased significantly since the beginning of the pandemic. Funding gaps are being amplified by the diversion of TB funds to address pandemic-related disruptions. Investments in need across TB and COVID need to be monitored. Many health facilities and programs have adapted the ways they deliver services and resources in response to COVID-19, which presents an opportunity for the future of TB care and prevention. There are opportunities to draw on this momentum to strengthen the overall TB response by adapting COVID-related strategies and taking advantage of innovative digital health platforms. So now conclusion and the path forward. So COVID-19 has set tuberculosis control efforts back by about a decade. This setback will probably translate into long-term increases in TB-related deaths and structural lung diseases. With low rates of COVID vaccination in TB endemic countries and the emergence of new variants, this trend is likely to continue. New strategies involving triage tools and innovative active case-finding interventions require urgent implementation to reverse these alarming trends. Active TB and COVID screening should be combined in tuberculosis endemic settings. The inability to distinguish between active TB disease and COVID has implications for strategies in TB endemic settings. Individuals with active TB and COVID should be monitored more closely with a lower threshold for referral and intervention. Ending the vicious cycle of poverty and death exacerbated by the twin epidemics of TB and COVID should be at the forefront. Addressing the mortality and morbidity associated with these two diseases will require global unity, political will, and addressing global inequities and power monopolies, improve funding for vaccine development, and enhance support for preventative and interventional strategies for both diseases. Here are my sources. I'd like to thank my parents, teachers, and mentors for their constant support in my STEM journey. I can be reached through email, LinkedIn, and Instagram if you have any questions. Thank you to GHLC for giving me this opportunity, and thank you all so much for listening.